गुड इवनिंग एवरीवन। मेरा नाम रोहन है। मैं क्विकसैंड एक संस्था है उसके साथ काम करता हूँ। क्विकसैंड एक रिसर्च और इनोवेशन कंसल्टिंग प्रैक्टिस है। हम दिल्ली, बैंगलोर और गोवा में स्थित हैं और मैं बैंगलोर के ऑफिस में काम करता हूँ। आप सभी का स्वागत है जेंडर कोलैब के इस इवेंट में, जो हम इंग्लिश और हिंदी साथ में दोनों भाषाओं में करने वाले हैं। If you remember, डॉक्टर दीपिका खाखा, जो मिनिस्ट्री ऑफ हेल्थ और फैमिली वेलफेयर से नर्सिंग एडवाइजर हैं, उनकी तबीयत खराब है और अनफॉर्चुनेटली वो हमारे साथ आज शाम को नहीं शामिल हो सकी हैं। पर हमारे बाकी सारे स्पीकर्स और हमारी मॉडरेटर हमारे साथ हैं। सो वी आर रियली लुकिंग फॉरवर्ड टू दिस सेशन। इससे पहले कि मैं और आगे बढ़ूं, हम कुछ ग्राउंड रूल्स आपके साथ शेयर करना चाहेंगे। हम इस सेशन को रिकॉर्ड कर रहे हैं ताकि हम इसे YouTube पे अपलोड कर सकें। अगर आप चाहते हैं कि आपका नाम रिकॉर्डिंग में ना आए या आप नहीं कोट होना चाहेंगे तो प्लीज कमेंट करें चैट सेक्शन में। ये एक कम्युनिटी ऑफ प्रैक्टिस है जिसके बारे में मैं आप सभी को बताऊंगा। प्लीज अपने आप को इंट्रोड्यूस करें अपने और अपने ऑर्गेनाइजेशन के नाम के साथ चैट बॉक्स में। हमारे साथ हमारी कॉलीग दीप्ति बापट हैं ओपीएम से, जो टाइम कीपिंग करेंगी हमारे लिए। और दीप्ति सभी स्पीकर्स को जानकारी देती रहेंगी कि अगर वो एक्स्ट्रा टाइम ले रहे हैं तो एवरीवन कीप एन आई ऑन दीप्ति's कमेंट्स और मैसेजेस। ये पूरे सेशन के दौरान जब स्पीकर्स बात करेंगे या मॉडरेटर बात करेंगे, अगर आपके कोई भी सवाल या टिप्पणी कमेंट्स हैं, प्लीज उन्हें बेझिझक चैट बॉक्स में शेयर करें या जब Q&A सेक्शन आएगा तो आप अपने हाथ भी उठा सकते हैं और हम आपको मौका देंगे बात करने का। जैसे कि मैंने कहा, ये सेशन हम हिंदी और इंग्लिश दोनों में मिक्स करके करेंगे। आप बेझिझक जिस भाषा में आपको कंफर्टेबल लगता है उसमें आप पार्टिसिपेट कर सकते हैं। Great. तो जेंडर कोलैब एक कम्युनिटी ऑफ प्रैक्टिस है जो सामुदायिक स्वास्थ्य प्रणाली या पब्लिक हेल्थ सर्विसेज में जेंडर को के लिए कैसे वैचारिकता बढ़ाई जा सके, जेंडर इंटेंशनैलिटी कैसे बढ़ाई जा सके, इस पे काम करती है। जेंडर कोलैब करीब 5 या 6 महीनों से शुरू हुआ था। इसके मेन जो ऑर्गेनाइजेशंस हैं ये ओपीएम हैं, जो कंटेंट लीड करते हैं, क्विकसैंड फैसिलिटेट करता है और ये बिल एंड मेलिंडा गेट्स फाउंडेशन के सपोर्ट से आगे बढ़ती है। इस कम्युनिटी में कई सारे भागीदार जुड़े हुए हैं। इसमें खास तौर पे यूपी और बिहार के हेल्थ डिपार्टमेंट्स के टेक्निकल सपोर्ट यूनिट्स हैं, और उसके साथ साथ जेंडर और हेल्थ पे काम करने वाले कई सारे विशेषज्ञ शोधकर्ता हमारे इस कम्युनिटी में जुड़े हैं। और मैं रिक्वेस्ट करूंगा कि अगर आपको ये इंटरेस्टिंग लगता है तो इसमें आप बस हमें कांटेक्ट करें और हम इसमें आपको भी आगे जोड़ सकते हैं। जेंडर कोलैब मेनली एक वर्चुअल कम्युनिटी है। इसकी सारी जानकारी हम gendercolab.in वेबसाइट पे शेयर करते हैं, जहाँ पे अगर आप जाएंगे तो आप देखेंगे कि ऊपर ही ये सेक्शंस हैं, जिसमें अबाउट पेज है, ऑफ कोर्स एक नॉलेज सेंटर है जहाँ पे हम अलग अलग रिपोर्ट्स, डॉक्यूमेंट्स, केस स्टडीज एक्सेट्रा अपलोड करते हैं। इसके साथ साथ एक ब्लॉग सेक्शन है जहाँ रिफ्लेक्शंस हैं, जहाँ पे कई सारे लोग अगर जिन्हें कोई फील्ड से रिलेटेड अनुभव शेयर करने हैं वो कर सकते हैं। इसके अलावा लर्निंग इवेंट्स हैं और पार्टनर्स हैं। रिया, if I can request you to mute someone who's unmuted, please. I'm sorry, I'll just pause for a second. Great, thank you. तो जैसा कि मैं कह रहा था कि इन सब रिसोर्सेज के साथ साथ हम वर्चुअल इवेंट्स भी करते हैं। हमारे 2 सत्र पहले ही हो चुके हैं। पहला वाला था रिस्पेक्टफुल केयर के बारे में, जिसमें हमने ये डिस्कस किया कि कैसे खास तौर पे रिस्पेक्टफुल मैटरनिटी केयर की डेफिनेशन को एक्सपैंड कर सकते हैं, और खास तौर पे डॉक्टर्स, हेल्थ प्रोवाइडर्स, नर्सेज, मिडवाइफ्स को भी इस डेफिनेशन के अंदर लाया जा सकता है, और उसको एक्चुअल में इम्प्लीमेंट करने के लिए क्या क्या अगले स्टेप्स होंगे एक्शनेबल चीज़ें क्या हो सकती हैं, वो हमने इस पहले सेशन में डिस्कस करी। सेकंड सेशन था हमारा विमेन्स लीडरशिप के बारे में, जिसमें हमारे 4 एक्सपर्ट्स ने ये बताया कि क्या-क्या प्रैक्टिकल स्टेप्स हैं जिससे विमेन की लीडरशिप, और ये बहुत आम तौर पे देखा गया है कि जितनी ज़्यादा महिलाएँ एक्चुअल में हेल्थ फोर्स में हैं, उतनी ही कम महिलाएँ लीडरशिप पोज़ीशंस में दिखती हैं। और ये हमारा आखिरी सेशन था जुलाई में। अ, और इसी से जुड़ा हुआ हमारा आज का सेशन है जो नर्स लीडरशिप है। अ, और हम बहुत एक्साइटेड हैं कि हम आप सबके साथ आज इसके बारे में चर्चा करेंगे। आज हमारे पास 3 स्पीकर्स हैं और एक मॉडरेटर हैं। इनका इंट्रोडक्शन मैं देने की कोशिश करूँगा, कुछ हिंदी और कुछ इंग्लिश में। पहले एवलिन कनन, जो ट्रेन्ड नर्सेस एसोसिएशन ऑफ इंडिया की सेक्रेटरी जनरल हैं। In her early career, she's worked as a community health nurse midwife, where she contributed to conduct and complete numerous healthcare projects in villages and rural areas. एवलिन खास तौर पे नर्सेज और दाइयों के एजुकेशन के बारे में बहुत ज़्यादा पैशनेट हैं। करीब 16 साल तक एवलिन ने क्रिश्चियन फेलोशिप हॉस्पिटल तमिलनाडु और सेंट स्टीवंस हॉस्पिटल दिल्ली में ट्रेनिंग कराई है। मिसेस कनन ने 2004 में ट्रेन्ड नर्सेज एसोसिएशन ऑफ इंडिया को ज्वाइन किया, और अलग-अलग कैपेसिटीज़ में कई सालों में मिस कनन ने काम किया है यहाँ पे। एडमिनिस्ट्रेटिव हेड जैसे वो 2016 में है। और खास तौर पे भारत में नर्सों की कुशलता या कैपेबिलिटी बढ़ाने के लिए एवलिन एविडेंस को कैसे प्रस्तुत करना है और किन के सामने प्रस्तुत करना है, इस पे खास तौर पे बहुत काम करती है। और ना सिर्फ गवर्नमेंट ऑफिशियल्स और उसके साथ-साथ इंटरनेशनल या नेशनल नर्सिंग ऑर्गेनाइजेशंस को कैसे साथ में लाना है, उस पे एवलिन ने कई सालों काम किया है। She's also the chief editor of the Nursing Journal of India and the TNAI Bulletin. We welcome you, everyone. Up next, we have Dr. Sanjana Brahmavar Mohan, जो Basic Health Services Udaipur की director हैं। बेसिक हेल्थ सर्विसेज एक नॉन प्रॉफिट ऑर्गेनाइजेशन है जो समुदाय में स्थित रिस्पॉन्सिव और एम्पैथी से जुड़ी केयर के बारे में काम करते हैं। इनका एक कॉन्सेप्ट है सर्कल ऑफ केयर, जिसके बारे में आज होपफुली डॉक्टर संजना से भी हमें सुनने को मिलेगा। उसमें बीएचएस काम करता है। बीएचएस उदयपुर में स्थित है और खासतौर पे उदयपुर के सबसे ज़्यादा वल्नरेबल कम्युनिटीज़ को एक नेटवर्क से जोड़ता है, जो प्राइमरी हेल्थ केयर भी देते हैं और न्यूट्रिशन सर्विसेज भी देते हैं। Dr. Mohan is an alumnus of the first cohort of India Leadership Journey, curated by Women Lift Health. And in her 25 years of experience, Sanjana has worked at tertiary care hospitals, anchored trainings for doctors and auxiliary nurse midwives. She's coordinated community-based trials and led the National Child Health Resource Center. She has an MD in pediatrics from the University of Rajasthan, and she's also studied epidemiology from the University of London. We welcome you. We also have Sonia Naveen Modia from Basic Health Services. Sonia is a nurse coordinator. Sonia is a primary healthcare nurse hailing from a very remote village in Udaipur. It's almost about 100 kilometers from Udaipur. The village is called Balicha. And she was the first woman in her village to study nursing and has done her diploma from Dungarpur district. Sonia has worked in maternal and child health hospitals in Ahmedabad before joining BHS in 2020. And at present, she's the nurse coordinator of the Amrit Clinic in Ghated, जिसके बारे में सोनिया हमसे और भी बताएंगी जिसके बारे में. Sonia values dignity and respect for her patients, and together with her team has managed thousands of patients, women, men, and children with diverse kinds of conditions. Their timely care has helped save hundreds of lives. Welcome, Sonia. And finally, we have our moderator for this evening, Dr. Kaveri Maira, who's a postdoctoral researcher at the University of British Columbia in Canada. डॉक्टर कावेरी मायरा एक मिडविफरी नर्सिंग और ग्लोबल हेल्थ रिसर्चर हैं जो इंडिया से आती हैं, और उनका पीएचडी है ग्लोबल हेल्थ में फ्रॉम द यूनिवर्सिटी ऑफ साउथहैम्पटन इन द यूके. For her PhD, she explored the experiences and determinants of obstetric violence. in India through an arts-based method called birth mapping. She won the research training funding from the Michael Smith Foundation for Health Research to work on a postdoctoral fellowship at the Birthplace Lab at the University of British Columbia. She's leading a project on the Continuum of Respectful Care and Midwifery Misfits initiative, alongside supporting the team on the lab and several other care-related initiatives. Uh, Dr. Myra has an extensive research experience on nursing, midwifery workforce policy, regulation, practice, sexual and reproductive health and maternal health care, and underlying gender-based challenges. Dr. Myra was recently recognized as one of the 100 outstanding global midwife and nurse leaders by Women in Global Health, WHO, ICN, ICM, Nursing Now, and UNFPA to mark the Year of the Nurse and Midwife in 2020. Welcome, Dr. Myra. So as I said, after this quick introduction that I've already made, Dr. Myra will take over as the moderator. There's a few questions that she'll ask the speakers, and then we'll get to an audience Q&A. Over to you, Dr. Myra.
आप सबका स्वागत है हमारे सेशन पे. And it's my privilege to be moderating this session. And I must start by saying that it's not leaders हैं जो अलग से आते हैं और लेवल्स पे लीडरशिप की भूमिका निभा रहे हैं. It is the need of the hour. It has been the need of the hour for different platforms की हम प्राइमरी healthcare systems nahi chal payega aage. We are called that we are the backbone of the health system. पर हम ये जानते हैं कि काफी बार काफी जगहों पे we are denied a seat, a table, a chair, basically a space and a voice as nursing leaders. जब बात आती है health policy making की, research की, decision making की, तो आज ऐसे ही काफी सारे मुद्दों पे हम चर्चा करेंगे. नर्सिंग लीडरशिप की जगह कहाँ-कहाँ है और कैसे इसे आगे बढ़ाया जाए. और it's really important to see that we have nursing leaders from different domains and areas who have been leading this work, and it's not just about nursing leaders, but हमारे बीच supporters और enablers भी हैं जिनकी मदद के बिना नर्सिंग लीडरशिप को बरकरार आगे बढ़ाना. About this session as I am, and begin with a very important just for the speakers, but it's also कि नर्सिंग लीडरशिप आप जवाब दे सकते हैं, किसी भी भाषा में आप जवाब दे सकते हैं. वो इस सवाल का कैसे जवाब देते हैं वो देख सकते हैं. In the next 1 hour or so, whenever you feel like, if you could please answer this question. आप चाहें तो ये सवाल लिख लें आपके पास. What does nurse leadership mean to you, and why is it important? साथ ही मैं ये सवाल रखना चाहूंगी हमारे
कावेरी, सॉरी टू इंटरप्ट यू, पर आपका आवाज थोड़ी कट रही है एक्चुअली.
What does nurse leadership mean to you, and why?
Hello, Kaveri, can you hear me?
रोहन, आप
Hello. Kaveri, there is, I suppose, a lag, but your voice is also breaking up a little bit. Maybe if you speak with turning off your video, we can try that. ऑल्सो मैं सबको रिक्वेस्ट करूंगा कि अगर आप स्पीकर नहीं हैं तो आप अपना वीडियो ऑफ कर सकते हैं। जैसे मैं देख पा रहा हूँ मिस शाइनी चाको, मिस पानी चक्रवर्ती, आप अपना वीडियो ऑफ कर सकते हैं प्लीज। थैंक यू, ताकि बैंडविड्थ थोड़ी बचेगी। बानी जी आप अपना वीडियो ऑफ कर सकते हो प्लीज। थैंक यू। सॉरी, बैक टू यू कावेरी।
Okay.
Yes, I could hear you, but maybe you'll have to speak a little bit longer for us to check.
This is a question is asked to me. Yeah. Can I start?
Yes, please, Evelyn. Please begin.
The question is over.
Yes, Evelyn, this is for you. Kaveri asks,
Okay.
why does nurse leadership matter to you, or what does it mean to you? Why is it important?
Okay. Thank you. Thank you so much for this opportunity which has given to me. For me, leadership is not a position or not a title or not as a flow chart, not as anything else. I feel nursing leadership means for me is to influencing the behavior of the people. Because I just, when I asked these questions, I was recollecting myself how I started my career as a, how somebody influenced me. I would like to say few example, few questions. Can you just place the PowerPoint, please? That picture.
Yes, I can do that.
Yeah. Because when I was just as a student nurses, because many of the people just influenced me by setting themselves as an example. Because I consider this a transformational leadership, changing. How I can get a change? I just place the three picture here to bring out something. It is really meant to me and helped me, and as well as helping me in a greater level. We are seeing the matchstick. One matchstick is correctly lightening, another one is just going towards it. I find it in this one is we need to empower people, because in my student period I born and brought up in a very small remote area. There I have seen there is no light, there is no street light, there is no much of the facilities. My father used to run around for all the municipality to get the things done, or the gram panchayat to done. I used to ask them, and his main aim is to educate the people. And the middle of the night, we have an hurricane line, and we will make them to sit, and we will make them to read and write, the village people. So that really influenced me. And he was he set an example how we can bring the modify the behavior. So he changed the behavior of the entire village by at least they should not put the thumb impression, they have to write it down. So second thing which influenced me to take up, to lead, or to do the something was my professional career during my student period. Because we used to go to the community, and there was one doctor, Dr. Rajkumar Ramasamy. He is from the Australia, and he came and he changed the entire villages by going there, and we could able to bring them a lot of maternal mortality, infant mortality. There he explained, we need to be with them, we need to motivate them, we need to inspire them. How? Then a total 8 villages he was really taking care, and we have learned. And he was not having the big title, he only influenced them, he empowered them. At times, as the matchstick shows that he said, we need to bow down at certain times, we need to sacrifice the timing certain times, and we need to walk extra mile at a time. So that was really, this all the things, the people to whomever I see, even some of the nurse leaders of those times, even they have done a lot of things in their life during the time. They have forego all the comfort zone, comfort the things, and they have. So these are the role models really made me to change a lot. But again, I felt this another picture which are showing about the shepherd. The shepherd, many of you have seen visually. I have seen many times because I was born and brought up in a village. And at time, the shepherd taught them, and they recognize the voice, and they will go after him, and he will guide them, he will lead them, he will inspire them as well as he will motivate them to take the better grass. At times, if they are making any mistakes, he don't mind raising the voice, and he don't mind raising the putting the hook stick to pull them down. At times I heard that even if they make a mistake in going little more higher, he will even break the leg and take them, put it on the shoulder. I find this is a leadership which I have seen, visualized. And Dr. A.K. Tarian was the founder of the Christian Fellowship Hospital. He was a very humble man. At the same time, he had led the entire, he said, great leadership. These are the area from home, from at the, as a student, I have learned from my teachers, and at the community, I learned from certain people. They all set an example. What I wanted to hear, because in my life, I have seen many role model as a nurse leader. Nurse leader is again not only the Secretary General of TNEI, because nurse leader is there here to motivate how I am motivating, how I am inspiring, how I am leading, how I am, because this was a leadership mean. We need to go into their level to head them out, to bring them out, to guide them. At the time, we need to be strict with them. At the time, we need to come together and hold together, because this all the things motivated me. I hope I am also implementing certain things. I'm not a perfect leader. At the same time, I'm a learning every day of my learning. And the 20 years of my service in even TNEI, many of our nurse leaders, they have set example. So I wanted to convey to them whoever, because now this is a time for us to transformational leadership. I need a change. If I need a change, I need to change myself. If I'm not changing, if I'm making that I am a leader or I am a title, I'm doing sitting like this, and we may not able to. We need to come down, we need to sacrifice, we need to walk extra miles, we need to do, so we can do. Can you show the second slide, please? Second one. Second, yeah. Before this slide. Yeah, after this. Who is responsible for a change? Sometimes we think that who is responsible. In my life, I have learned these things. That's why I'm saying that what does leadership mean? I think as a leader, I need to have a vision. What I'm going to do, what I need a change, what I need a change in my organization, what I need a change. Before that, head one. Sorry, yeah. So as a leader, I think we need a vision. I had some vision. I wanted to, after I became a student, I had a vision that I wanted to become a nursing teacher. I became. Then I wanted to work as a tutor I wanted to, I joined in TNEI. So we need to have a vision what we are going to do. Not only vision will not helpful, vision as well as we need to, then I need to that, we need to have a heart, that vision need to be changed, a heart. That we need, I think, I worked with them, I talked to them, I asked them, I asked the things, and not only that, heart alone is not sufficient. I need to put it in action, what I am teaching. That's why we said transformational leadership is essential. That has to be habit. For example, if I'm telling them you all have to be at 9 o'clock, if I'm getting 11 o'clock, I'm not making a change. I need to be there at least the same time or 1 minute even before. So that has to be my habit. I think this also helped me, meaning to me as a leader, I need to set an example. Then again, next one, final slide, please. Next slide. No, before that, I, you, me. Before that, yeah. So sometimes I may have a vision, I alone cannot do anything else. So I need a complete, that we have a very good leadership here. We have our national president TNEI, we have a vice president regional, we have a complete, that means executive members, our own colleagues, those who are with me, entire staff. From the chowkidar to the top level. So I am responsible. I feel as a leadership for me, I alone is not sufficient. Everyone next to me is responsible. Another one is that we all together. So this I, you, we, that is in me. That is why I feel that is a leadership is very important. Making a change in any set of organization, even at home. I think as a self-realized leader, If I'm proper at home, definitely I can bring the better, the two children as a generation. If I'm working in the organization, if I trust them, I empower them, make them to do, that is really helping me. This is what I feel very important as a nurse leadership. This not only helping me personally as well as my nursing leadership, this is also equally why it is important, because we are dealing with the patient care. Because every nurse, whether you are a teacher, you are a researcher, you are a graduate, that means administrator, I need an example. I need to collaborate. We all have to come together. Our main purpose, ultimate responsibility is for patient care. Because now the global is keep changing. We need to keep changing ourselves. That's why we need to have a head full of knowledge. And also empowering others to do better, as well as we need to have a collaborative effort. When you do this one, I hope I tried my level best to put it in this way. And I have practicing in trying my level best to put it in, not only having a vision, put it in practice. I think with the able leadership of the TNAI, with our National Council member, we could be able to last 5 to 6 years. We have grown into much higher way for the benefit of the entire nurses in India. Thank you. I hope I answered your first question. What does leadership mean? Is a behavioral changes, making a change, influencing others.
Thank you so much, Sanjana ma'am. Can I quickly check if I'm audible now?
Yeah, this is better.
Yeah. Okay. Thank you so much. Can I ask the same question now to Dr. Sanjana Mohan? कि nurse leadership आपके लिए क्या मायने रखता है? As an enabler, why do you feel this is important? Over to you, Dr. Mohan.
Thank you, Kaveri, and thank you to the organizers for inviting us here. I think मेरे लिए जो nurse leadership है, my own ideas, ये काफी I have got these two here from our own work. थोड़ा सा मैं उससे शुरू करूँगी. So basic healthcare services एक not for profit organization है जो कि primary healthcare की field में काम करती है, rural remote communities, and care that is high quality, low cost and provided with dignity. तो हम लोग 6 प्राइमरी हेल्थ केयर क्लिनिक्स रन करते हैं, एक गवर्नमेंट पीएचसी रन करते हैं जो 24/7 सर्विसेज प्रोवाइड करते हैं. एंड इन लास्ट 10 years अगर मैं देखूं तो टुगेदर आवर टीम्स हैव प्रोवाइडेड केयर टू over 5 lakh patient visits. They've conducted thousands of deliveries, seen thousands of patients with tuberculosis, performed antenatal checkup, seen children with severe malnutrition, and the entire range of conditions जो कि हम primary care में देखते हैं. And really, the presence of our nurses, there are 35 to 40 of them at any time. It is that ensures this continuity of care available round the clock. So my own idea for nurse leadership also comes from working closely with our nurses, plus also seeing government nurses from close. So what I see a lot is that, nurses are under a lot of pressure. And this I'm talking more from primary healthcare, from secondary healthcare perspective, but I think there would be commonalities anywhere as well. So, there is a lot of pressure. Also, the environment where they work is a bit indifferent. There isn't उनको इतना support नहीं मिल रहा जितना उनको चाहिए अपने field में. उनके targets होते हैं, huge targets, a lot of pressure कि targets meet करें वो. अगर कोई difficult delivery आ रही है, कोई postpartum hemorrhage हो गया, you might find that they are alone. कोई उनको support करने वाला नहीं है. Even जब वो field में जा रही हैं, कैसे वो hemoglobin measure करें, कैसे blood pressure measure करें, nobody is there to guide them. At the same time, even उनकी families से we see them having a lot of pressure. And हम देखते हैं हमारे work में भी इतनी बार pressure होता है nurses पर कि अपना काम छोड़ के घर चले जाएं. There may be other demands. कभी अगर उनको ट्रेनिंग के लिए कहीं हम बाहर भेजना चाहते हैं तो प्रेशर आ जाता है, नो दे कैन नॉट गो आउट. तो इस एनवायरनमेंट में भी सी कि एक स्ट्रगल रहती है कांस्टेंट. सो उनके कॉन्फिडेंस, मोटिवेशन दैट सफर्स अ लॉट. एंड ये दिखता है कि डिसीजन मेकिंग कहीं और है, उनके पास तो नहीं है. तो जब मैं ये सोचती हूँ तो मेरे लिए जो ड्रीम है नर्स लीडरशिप की, it is when our nurses believe in themselves. They believe that they are in charge of their lives, ना? और उनकी पर्सनल लाइफ, उनकी प्रोफेशनल लाइफ, they are in charge. Plus ये भी कि उनमें they have what it takes, कि वो हर कुछ कर सकती हैं जो कि जरूरत है उनको करने की. फिर एक बात ये है कि ये इम्पोर्टेंट क्यों है नर्स लीडरशिप. तो क्लियरली ये दिखता है कि उनके कॉन्फिडेंस मोटिवेशन के लिए ये इट इज सो इम्पोर्टेंट. और जब हम देखते हैं नर्सेज वर्किंग विद अस एंड वी लुक एट नर्सेज वर्किंग इन द गवर्नमेंट इन मेनी प्लेसेस, उनकी बॉडी लैंग्वेज हमें बता देती है कितना हाउ दे आर द शोल्डर्स, हेड हेल्ड हाई, ऑल ऑफ दिस. प्लस ये दिखता है कि कितना इंपॉर्टेंट है टू बिल्ड स्ट्रॉन्ग टीम्स. अभी हमने सुना डॉक्टर इवलिन ने बताया कैसे इवन शी वाज इंस्पायर्ड इन द बिगनिंग, और इनसे आगे कितने लोग इंस्पायर हुए. तो हम खुद इमेजिन करें, देयर आर मेनी मोर नर्स लीडर्स, how many people are they inspiring then? Not only nurses, it is others as well. There are ashas, there are also doctors. So we also are inspired so much by what our nurses are doing. And this environment really builds up strong teams. And next, जब हम देखें कि जब strong teams होती हैं, then we will be able to tackle our needs on the ground. अभी हमारी challenges क्या हैं? Women don't come for checkups. We lose women. There are maternal deaths happening. But if there are strong teams, we are in such a stronger position to really catch every pregnant woman with a complication, to make sure all people with diabetes are under constant follow-up, dropout nahi ho rahe, all children are immunized. So it is really crucial. I will end here.
Thank you so much, Dr. Mohan. I think I will take away the key word of strong teams from your message, because I know for a fact that we see so much of this, and if we have the respectful communication and those relationships become respectful in our workplaces, I think that will have a greater impact, not just on primary care, but also in enabling nursing leaderships. Thank you so much for that. मैं ये same सवाल रखना चाहूंगी हमारी आखिरी स्पीकर मिस सोनिया के लिए. सोनिया, क्या आप बताएंगी कि नर्सिंग लीडरशिप आपके लिए क्या मायने रखता है, आपके लिए ये क्यों जरूरी है? सोनिया.
थैंक यू. सबको नमस्ते, मेरा नाम सोनिया है. क्या आप मुझे सुन सकते हैं?
यस.
ओके. एक नर्स लीडर के रूप में एक नर्स अपने आचरण, विश्वास और व्यवहार के रूप में काम करती है. जिस साथ में काम करने वाली मेरी टीम और समुदाय में लोग, जिसे मैं मतलब उनके साथ अच्छे से काम करना और उनकी बातें सुनना, उनको समझना और उनकी समस्या का समाधान करना, और लोगों की बातों को सुन के स्वयं समाधान निकालना एक नर्स लीडर में ये गुण होते हैं. और जैसे एग्जाम्पल के लिए हमारे क्लिनिक में एक महिला आती है, उनका नाम सविता है. तो जैसे उनको वाइट डिस्चार्ज की प्रॉब्लम थी, तो उनको ये डर था कि मेरे साथ कैसे मतलब करेंगे, किस तरीके से बात करेंगे, मैं सबके सामने ये बात बता सकती हूँ, नहीं बता सकती हूँ. तो मैंने कहा कि पहले तो उनका मतलब नमस्ते किया, फिर मेरे समान स्तर पे बिठाया उनको. उसके बाद मेरा स्वयं का परिचय दिया उनको. उसके बाद उनका नाम पूछा. फिर मैंने उनको विश्वास दिलाया कि आप मुझे प्रॉब्लम बताओ, मैं आप पूरी गोपनीयता रखूंगी, किसी और के साथ मैं शेयर नहीं करूंगी, इस तरीके से. तो फिर उन्होंने बताया कि वाइट डिस्चार्ज की प्रॉब्लम है. तो फिर मैंने उनको प्रोत्साहित किया कि आप बताओ ऐसे करके. तो उनके खून की जांच और पीवीपीएस के बारे में बताया, तो वो मतलब आसानी से तैयार हो गए और उनकी जांच की और ट्रीटमेंट दिया. इस तरीके से हमने उनको विश्वास दिलाया. एक विश्वास दिलाना लोगों के मन में विश्वास दिलाना बहुत बड़ी चीज होती है. वो किसी पे आसानी से विश्वास नहीं करते. तो एक नर्स लीडर होती है जो लोगों के मन में विश्वास बनाती है, और एक व्यवहार बनाना पड़ता है, अच्छे से बात करनी पड़ती है, कोई नर्स लीडर के रूप में होता है. और वो जो पेशेंट होते हैं उनके स्वास्थ्य से संबंधित फिजिकली, मेंटली, सोशली रूप से उनकी स्वास्थ्य समस्याओं से संबंधित समस्याओं का निवारण करती है, समझती है उनको। और टीम में जैसे टीम को साथ में लेकर के चलना, उनकी जो भी प्रॉब्लम आ रही है उनको समझना और उनको साथ में लेके चलना और उनके अच्छे काम को प्रोत्साहित करना और उनको उनकी जो काम कर रहे हैं, नई चीजें सीखनी है, उसमें हेल्प करना। ये मेरे लिए मतलब मैं बोल सकती हूँ। और डिसीजन मेकिंग जैसे स्वयं निर्णय ले सकती है, जो नर्स लीडर होती है वो स्वयं निर्णय लेने की क्षमता रखती है। और मतलब मेरे में एक विश्वास है कि मैं कर लूंगी और मैं कर सकती हूँ, ये चीज होनी चाहिए।
थैंक यू सो मच सोनिया जी। आपकी बात से आई थिंक दो चीजें मैं लेके चल रही हूँ मेनली। एक तो प्रॉब्लम सॉल्विंग, डिसीजन मेकिंग कितना इम्पोर्टेंट हो जाता है ग्रास रूट में, और ये भी कि ट्रस्टिंग रिलेशनशिप बनाना, सबका भरोसा रखना और उसको लेके चलना, और ना कि जस्ट खुद के लिए लीडरशिप को प्रोत्साहित करना, उसको आगे बढ़ाना आपके स्तर पे भी और हर स्तर पे ये कितना इम्पोर्टेंट है। थैंक यू सो मच ये बताने के लिए। हम वापस से हमारे पहले स्पीकर से शुरुआत करेंगे, एंड वी विल change the questions this time a little bit. Again to Madam Evelyn Kannan, my question to you, and this time you will have 7 minutes to respond to this one, is what is an association's responsibility to facilitate, motivate, and sustain nurse leadership in the country? And how does Trained Nurses Association of India, TNAI, contribute to that, and what challenges do you face? तो एक एसोसिएशन की बेसिकली क्या जिम्मेदारियां रहती हैं कि हमारे देश में नर्सिंग लीडरशिप को वो कैसे प्रोत्साहित करे, कैसे आगे बढ़ाए और बरकरार।
Can you place that PowerPoint, please? Last slide. Yeah. So I put all the things in one slide, and it's as you all know that the Trained Nurses Association of India is a 115 years young association, and it was started in the 1908 with a lot of vision by the nurse leaders, and they have first and foremost, immediately they thought that the TNA responsibility in facilitating, motivating, and sustaining nurse leadership in the country is mainly they wanted to publish. They created the Nursing Journal of India because this was the only medium of communication to the entire nurses. So they started the Nursing Journal of India. It was one of the world third journal. First one is American journal, second is a British journal, and third one. So initially they thought that publishing the journal was important. Since then we communicate, through that we communicate to the entire nurses in India. Then we have a lot of educational program. They started since I think many years before. They started this national workshop, this national conferences, because through this they disseminate information, various dialogues and various scientific paper presentation. So many things happen. So this will help them to even know how to develop the leadership, how to present, and so many education program happens during the national conference, which is every year we organize for the trained nurses as well as the student nurses. And again, we also the educational grant has been given to all the, not only at the national level, all the grant is available for the state branches. Because as we have a 34 branches across India. All the 34 branches, we ask them to conduct 7 days workshop and 5 days workshop, and that will help them to have the educate the people about the various topic, mainly about the leadership, about the respectful maternity care, and all the other educational program. And scholarship and grants since 1981 onwards, we have started giving the scholarship. This will help them to take up the higher position, higher studies studies, so that they can, even undergraduate students as well as the postgraduate students, to help them to develop themselves to become a leader, and this also will help them to give them. And networking is we have a great network with across the nurses, and around even we have the 34 branches with over 4 lakhs nurses and 2.5 lakh student nurses, and under the umbrella of the TNI we have more than 1,800 institutions. Any information we want to give, immediately we'll communicate to the entire nurses. We have a great networking. This is helping us to facilitating, motivating and sustaining the nurse leadership. And recognition award, since 1971 we requested the government to give them award for the best nurses, National Florence Nightingale Award, and now most of the states also giving the state award for the nurses, as well as we are also, TNA also gives the award at the national level, best lifetime achievement award for the 5 regions. So we are time to time we recognize the nurses, because recognition is very much essential to motivate them to motivate them or inspire them to do the better thing. And advocacy and policy influence since the beginning, because the TNI was instrumental in establishing the system of formal education as well as the regulatory body. And since we are the liaison between the nurses as well as the government, we make all the advocacy and policy influences, because this is also one of the major concern of the TNI. Research support, and TNA established a research grant, and since 1920, since 1971, we are given the importance of the research, but recently we started giving the individual grant to the nurses, and this all the recent development. Since 1920, we have started giving, mainly focusing on the evidence nurse practitioner, evidence based nurses, that means practice or a research. We are asking them to do it individually as well as a group. This is not supporting the MSc or PhD. This is after completion of the studies. And online resources is available. We created the learning management system. Once we come to know that India is suffering the pandemic, immediately we created the learning management system, and we could able to educate the 2.5 lakh nurses as well as the student nurses across India how to handle the this kind of situations. And collaboration with the academic institution. Now we are already in the world level, world continuous education program alliance, we are collaborated, and all the things is free of cost. We are uploading everything on the learning management system, and with the credit hours, and it's given to the nurses to empower themselves time to time to know the current situation and knowledge, so that they can able to give them the better care. And promoting diversity and inclusion, because we are also collaborate with the various organizations to them. Now recently we also collaborated with the Alive and Thrive, and we are going to start the fellowship program, TNA fellowship program in conjunction with the other people, and again other organization, again the TNI. Now recently we had that means we had an executive committee meeting. There we have taken a decision to collaborate with various other organizations also, to how we can have the development and advancement opportunity. And TNA established the Central Institute of Nursing and Research Center at Greater Noida, where we have a simulation-based training, BLS training, advanced life support training, as well as the reproductive, maternal and child health training. So we are educating doctors as well as the nurses, upskilling, because we are that means we wanted them to have a head full of knowledge, and so that they can able to provide the better care. So that is the reason we are having all these things. And continuing education also, we will be continuously, we are concentrate on upskilling, and we are also DNA also has a plan to establish a 5 simulation lab in 5 regions, so that they need not to come all the way to the Delhi. So these are the major things already in progress, as well as we are also created the museum, nursing in the past and the present and the future, how the nurse leaders set up the way even in those days, and now how it's coming up, And what are the things we are doing? These all the things already. We have a world-class museum. Shortly it will be inaugurated. Everything is in digital. And again, we have the platform for the NJ Nursing Journal of India portal. It's available to the free of cost to the entire nurses in India, so that they can equip themselves with the varieties of knowledge. One more slide. And in the coming recent meeting, we had one more decision to get how to do the reforming the leader, that means future plan, leadership and mentorship training for young nurses. So because now as we know that the young leaders are having innovation ideas, and they have a lot of technology. So now we have taken a decision how we can collaborate with the other branches. We are going to start the mentorship training for leadership on the training program for the youngest nurses, with the short-term courses. It's going to come on the, it's on the way. We are preparing. I hope during the time of our national conference, it will be again inaugurated. So this all the plans already is there. This is we are going to do. The TNA always work for the welfare of the, not only welfare of the nurses. Main focus is of the objective is to equip themselves on a continuous professional development. So these all the things are there. And based on that, again, the TNA had to take a decision. All the institutions should have mannequins. So whoever is under the umbrella of the TNA, the SNA unit, around 500 to 600 schools and college of nursing, we send a mannequin so that they need not to come. They can learn the procedure, hands-on skill themselves. Again, now we have taken a decision, even that can be given to the hospital if they have a more than 200 TNA members. So slowly, TNA is always thinking about the welfare of the nurses, as well as how to equip themselves, be confident, and we will how to inspire the nurses, how to motivate them to take up the leadership role. This is constantly we are striving and working as a together. We can achieve this. And some of the challenges is that even though we have a lot of trainings and upskilling, that things are available, and challenges is not coming forward to take up the training, because they are not given much importance to that. So we are requesting the government to make it as a mandatory for all the nurses to at least once in a year or once in 2 years, they should equip themselves. Now almost all the council have taken a decision, even few of the council yet to take a decision, nursing council. So if after every 5 years, they have to have renew their license by equipping themselves on the continuing nursing education. So if they equip themselves, then they can again give a better care. But so one of the major challenge which we are facing is a lack of unified voices, because among the nurses. So this is one of the things is a greater challenge which you have. We have to have come under one voice, one area, for one cause. That is a bit lacking. And limited opportunity for continuous professional development, even though it is a chain is available, but there are people are not having a time, maybe not sponsoring. So many other things are there, and lack of training opportunities to the doorsteps. So we are identifying these all the areas. Now slowly we are spreading to the entire state. Not that we are expecting them to come to TNI. Slowly we are this time the leadership in TNI, they have taken a decision to visit the interior states and helping them out and finding out the problems and helping up in all the areas. So I think we are anyway, long way to go. We have achieved something. Still, there are a lot of things, a lot of areas we need to cover. I hope our TNI under the able leadership of the national executive and the council will take more and more decisions like this and be able to do much more for our nurses in India.
Thank you, Evelyn, ma'am. This is such a long history of TNI that you have managed to summarize in just a few minutes. And also, I do agree, if it is over 5 lakh nurses that are members of TNI, finding one voice can be a tremendous challenge. But yes. Good luck to you. And my next question is but now...
Still hum honge kamyab. Still hum honge kamyab. Ek din. Yes.
Dr. Sanjana Mohan, my next question is to you. प्राइमरी हेल्थ केयर लेवल पे आप नर्सिंग लीडरशिप को बढ़ावा दे रही हैं, स्पेशली एक रूरल एंड रिमोट एरिया में. आप अगर बीएचएस की एक्सपीरियंस से हमें बता सके कि ये कैसे मुमकिन हुआ, दैट वुड बी ग्रेट. थैंक यू.
थैंक यू कावेरी. तो कावेरी मैं थोड़ा बात करूंगी, स्टार्ट करूंगी कि प्राइमरी हेल्थ केयर में किस तरह की नीड्स हम देखते हैं। ये नीड्स हैं रूरल राजस्थान की, पर शायद लार्ज पार्ट्स ऑफ द कंट्री में हमको सिमिलर नीड्स दिखती होंगी। सो एज यू नो, हम डाइवर्स काइंड्स ऑफ कंडीशंस देख रहे हैं प्राइमरी हेल्थ केयर में। A huge burden of infectious diseases, tuberculosis, malaria being very common. NCD is also growing steadily. Malnutrition एक बड़ी समस्या है, mostly among women and children, but also men are not spared. And the entire range of reproductive health conditions. तो ये सब, and there is a need for services 24/7, जिससे कि जो रियली नीड्स हैं कम्युनिटी की वो हम मीट कर सके, बिकॉज द डिस्टेंसेस आर सो मच, ट्रैवल ऑप्शंस नहीं हैं, एंड अनप्रेडिक्टेबिलिटी है। कब किस व्हेन अ डिलीवरी कम्स यू विल नेवर नो इट बिफोर। सो देन अल्टीमेटली इट कम्स डाउन टू कि एट द हेल्थ केयर फैसिलिटी we need somebody 24/7, need somebody with knowledge and skills, and also with the human touch. जो point सोनिया ने भी बोला, that how do people start to trust and really open up before the providers. What we've seen is that nurses are the best suited, to provide this role. And across our clinics, our nurses play the central role. They lead the clinics. They are supported by our teams of doctors and healthcare workers, but it is really they who are there ensuring this continuity of care. So together we see them providing care for the entire reproductive health cycle, treating infections timely. In fact, in one area of our work, till 4-5 years ago, we would see thousands of cases of malaria every year and hundreds of deaths. Aaj hum dekhen to these have really come down. We don't see more than a few hundred cases. This has been possible because of continued care there. Now, to make this possible, I feel there are few important elements. I would just like you to go to the next slide. The next one. Yeah, this one. So, agar main dekho ki how has this been possible? So I'll start with trainings. So training is really important. And there is a constant process of training starting from the beginning, but then repeated every other month, online, in person, training in knowledge, in skills, in competencies, in soft skills, and backed up by job aids and protocols. So, for example, agar koi bhi, if a person with fever comes to the clinic, our nurses know that they have to check for malaria. If it turns out to be malaria, unko pata hai ki unko kya treatment dena hai. And I've also met with, many doctors who also are not aware of, the exact treatment for malaria. But the nurses are able to do this. The other thing, jo bhi training ko aur complement or enhance karti hai, that is on-job mentoring and support. So our team of mentors, they are there always. So if there is a very sick child, the mentor will go and support the nurses. Agar koi delivery hai with some complication, that time too the mentor would just go. Or even if not, then available on a video call and help guide. In fact, there have been times when at night, very difficult deliveries, they've supported through being on video and guiding our nurses. And we see this giving a lot of strength. In fact, हमारी nurses हमको बोलती भी हैं कि क्योंकि वो mentors उनके पास होते हैं, तो इससे they get a lot of confidence and are able to really do a lot. We see technology as having a very important role as an enabler. So the tests that they have, the point of care diagnostics, which helps them diagnose the different conditions, the option of telemedicine, actually more than telemedicine, it is maybe video calling or sometimes even a call, because many of the areas में वो network है नहीं जिससे कि telemedicine अच्छे से enable हो सके. And having a team approach to primary care. So it is not कि all the responsibility lies on the nurses, but for example, if there is a woman with severe anemia, it is our health workers who will take the lead. वो घर जाएंगे, वो counsel करेंगे, and they will encourage the women to come back to the clinic. अगर trainings हैं, so our doctors, our nutritionists, other team members वो step in करेंगे. So work is nicely shared, and I can say it is task sharing across the entire team and not really task shifting. But at the core really are what you see here. It is dignity and respect. So in fact our colleagues at IIM उन्होंने in-depth interviews किए थे nurses से. So nurses ने बहुत बात करी इस बारे में कि वो ये value करती हैं कि सारी team they sit at the same level. वो खाना साथ खाते हैं. This is important to them. वो ये भी appreciate करती हैं कि अगर कभी कुछ चीज miss हो जाती है तो जो feedback है वो उनको privacy में दिया जाता है. And it is not that they are pulled up before many people. Also recognition for the great work that they do. So if there is a difficult delivery जो हमारी nurses ने करी है, it is shared in groups and everybody recognizes, appreciates. If they diagnose a person with diabetes, that's a huge thing. So that is also recognized. In fact, we did stories of our nurses for Women's Day, and I would really encourage all participants कि एक बार वो भी देखें. They inspire us a lot. और हमें ये पता चला कि जो nurses की families भी थी, nurses खुद, they were just so happy. They told us कि उनकी family was so moved, and they said to them कि हमें नहीं पता था कि तुम इतना काम कर रहे हो. And finally, there are opportunities for growth. As nurses grow more senior, they have the possibility of becoming nurse coordinator. As Sonia today, she is a nurse coordinator. Later on, there is also the scope for them to become nurse mentors. So they keep learning, they keep growing, and getting more and more responsibility. तो हमें लगता है कि ये जो सारे important areas हैं, ये बहुत crucial हो जाते हैं for nurses to become more and more stronger and become more and more more influential leaders as well. Thank you.
Thank you so much, Dr. Mohan. I'm still picking up on the dignity and respect and the specific examples you gave. एक ही level पे सभी का बैठना, एक साथ सबका खाना खाना, especially about giving the feedback for growth in privacy and also, recognizing the small and big wins. It's so important to learn from these routine, ways of collaboration and working together. Before I go to Sonia for the last question, मैं सभी participants को याद दिलाना चाहूंगी कि आपके पास अभी भी वो एक सवाल है आपके लिए क्या म्यूट कर सकते हैं? I'm hearing some music.
Yeah, we're on it.
So everybody, if you could please answer that question. मैंने कुछ responses देखे हैं chat box पे, पर बाकी सब भी अगर इसका जवाब लिख देंगे तो that would be great. सोनिया, आपसे मेरा आखिरी सवाल है. Thank you. सोनिया, आप सतह पे काम कर रही हैं as a nurse leader, एकदम प्राइमरी लेवल पे, और आपके नेतृत्व में एक पूरा अमृत क्लिनिक है जो आप मैनेज करती हैं, वहां पे आप सारा काम संभालती हैं. तो ये आप कैसे कर पाई ग्रासरूट्स, और ये आपके पहले के एक्सपीरियंस से, काम से कैसे अलग है? आप प्लीज बताएं.
जैसे मैं नर्स लीडर के रूप में काम करती हूँ तो एक ट्रेनिंग की हुई हूँ मैं. मेरी आवाज आ रही है आपको?
जी हाँ, आपकी आवाज आ रही है.
हाँ, तो मुझे जो काम है वो सारे व्यवस्थित रूप से करना पसंद है और मैं करती हूँ. और इसलिए मतलब जैसे पहले मैं मेरे जो कोऑर्डिनेटर थे उनके इंस्ट्रक्शन फॉलो करती थी, और अभी मैं खुद प्लानिंग करती हूँ और फिर टीम के साथ में चर्चा करके फिर वो सब इम्प्लीमेंट करती हूँ और उनको इंस्ट्रक्शन देती हूँ, उनसे काम सिखाती हूँ उनको, और ये करती हूँ। और एक टीम लीडर होती है, वो मतलब जैसे कहा जाए तो फील्ड में बहुत सारे सवाल आते हैं तो उनका स्वयं निर्णय लेना पड़ता है, बहुत सारी प्रॉब्लम्स भी आती है तो उनको टीम के साथ में चर्चा करके फिर उनका सॉल्यूशन भी निकालना पड़ता है स्वयं ही। और पहले के काम में और अभी के काम में बहुत फर्क है, क्योंकि पहले तो मैं इंस्ट्रक्शन फॉलो करती थी और अभी मैं खुद प्लानिंग करती हूँ। जैसे हमारे मतलब क्लिनिक में 6 का स्टाफ है, जैसे 6-7 का स्टाफ है, 2 हेल्थ वर्कर और 4 नर्सेस है और एक चौकीदार भी है और बाईजी भी है। तो हमारे मतलब रूटीन रहता है कि हर मंथ में मंथली प्लान बन जाता है और हम डेली बेस पे भी प्लानिंग करते हैं। सुबह में जैसे 9:30 बजे से 5:30 बजे तक हमारा क्लिनिक खुलता है डेली पे, और इमरजेंसी सेवाएं तो 24/7 रहता है। तो हम सुबह से मतलब जैसे कौन क्या काम करेगा ये सब प्लानिंग भी होती है कि आज कौन फील्ड में जाएगा, ये पहले से तय होता है। तो उसके हिसाब से नर्सें भी जाती है, तो वो सब करना होता है, और पेशेंट देखना और केस की एंट्री करना, और कोई इमरजेंसी केस आता है तो उस टाइम पे सारी तैयारियां पहले से ही करके रखना, ये सब चीजें होती है। तो वो चीजें भी करनी है, मतलब सब मानते भी है, और किसी को कोई प्रॉब्लम आती है तो मैं मतलब उनके साथ में बैठ के डिस्कस भी करती हूँ ये। और फिर शाम को जब सब आ जाते हैं फील्ड से और हमारा काम हो जाता है तो हम शाम को बैठ के डिस्कस करते हैं कि आज क्या क्या काम हुआ। तो इस तरीके से हमारे काम में कितना इम्प्रूवमेंट हो रहा है, हम लोगों के साथ में कैसे जुड़ रहे हैं और लोगों के मन में कैसे विश्वास डाल रहे हैं, और मेरी जो टीम है वो मेरे पे कैसे विश्वास कर रही है। तो वो चीज है, वो मुझे मतलब एक लीडर के रूप में वो मुझे देखते हैं और मेरी भी सहायता करते हैं। जैसे मुझे कोई भी काम है, जैसे मतलब निर्णय लेने में कोई दिक्कत आ रही है तो वो मैं उनके साथ चर्चा करती हूँ। और ट्रेनिंग भी हुई है हमारी, और एचओ टीम का भी मदद रहा है, और जैसे समुदाय में जो समस्या आ रही है उनको भी मतलब चर्चा करके भी सॉल्व किया है ऐसे, तो काफी फर्क तो है। और क्या सवाल था मैम?
आई थिंक आपने जवाब दे दिया, क्योंकि मैंने आखिर में पूछा था कि आपके पहले के काम से ये काम कैसे अलग है, और सतह पे आप एक अमृत क्लिनिक संभाल रही हैं तो उसका भी एक्सपीरियंस कैसा है। तो आई थिंक पर इससे जुड़ा हुआ अगर और कुछ आप अपनी बात रखना चाहती हैं तो प्लीज बताइए।
कि हाँ, मैंने मतलब मैं पिछले 2.5 साल से काम करती हूँ अमृत क्लिनिक में, और यहाँ पे मतलब मैंने इतना देखा कि हम अच्छे से जैसे आराम से बात करना, सब मिल करके रहते हैं, और बातों को सुनना, टीम की बातों को सुनना, समझना और उनकी समस्या का समाधान करना और मिल के रहना और लोगों के साथ में व्यवहार बनाना, ये एक नई बात है जो मतलब एक बड़ी बात होती है हमारे लिए कि मिलके रहना। कोई मिलके नहीं रहते हैं ऐसे, हम देखने चाहते हैं तो हमारे क्लिनिक टीम मतलब पूरा ऐसे व्यवहार रूप से सब मिलके रहती है, तो ये फर्क है।
थैंक यू सो मच सोनिया।
थैंक
सुन के कभी कभार ये बहुत ही अजीब लगता है कि मिलके रहना इतनी आम सी बात है और हमें रूटीनली घर में अपने काम के क्षेत्र में ये करना चाहिए, बट अगर ये अलग है और इसकी इतनी ज्यादा जरूरत है हमारे काम में तो सोचने की बात है ना। थैंक यू सो मच। ये हमारे सारे सवाल आई थिंक खत्म हो चुके हैं। इससे पहले कि हम ऑडियंस के सवाल हमारे स्पीकर्स तक रखें, मैं एक कोशिश करना चाहूंगी सारी बातों को समराइज करने की। काफी डाइवर्स बातें हुई हैं यहाँ पे नर्सिंग लीडरशिप को लेके। हम एसोसिएशन से लेके ग्रासरूट्स तक गए हैं। हम नर्सिंग लीडर जो लीड कर रहे हैं उनसे लेके we have also heard from enablers and supporters who have been encouraging leadership. There are a few keywords that I will mention. I am particularly inspired by some of the things our speakers have said, like having a vision for change. I think ये बहुत important है कि आपका vision क्या है, आप क्यों और क्या बदलना चाहते हैं, and walking the talk. जिस तरह से मैडम एवलिन बता रही थी कि leading at home and professional work. It's like leading is a lifestyle and she practices it routinely. हर रोज की जिंदगी में वो इसे प्रैक्टिस कर रही हैं. डॉक्टर मोहन की काफी बातें आई थिंक रिस्पेक्टफुल रिलेशनशिप को लेके और रिस्पेक्टफुल टीम डायनामिक्स को लेके कि एक टीम में जितने लोग हैं सबका बराबर होना और सबका एक दूसरे से इज्जत से पेश आना, एक दूसरे की बातों को काम को वैल्यू करना और इनकी जो छोटी छोटी एग्जाम्पल उन्होंने दी हैं जो अमृत क्लिनिक फॉलो करता है, जो बीएचएस के एक्सपीरियंस में वो बता रही है. आई थिंक इट्स अ वेरी इंपॉर्टेंट एग्जाम्पल and a model that needs, to be learned about, that we all need to learn from and replicate in all our healthcare facilities. सोनिया जी, मुझे बहुत अच्छी लगी ये बातें जो आपने ट्रस्ट को लेके कही, और ये बात जो आपने ट्रस्ट को लेके कही, आपने समाज में जो लोग हैं जिनका आप ख्याल रखती हैं, जिनको आप केयर प्रोवाइड करती हैं, उनसे लेके आपने जो आपके टीम मेंबर्स हैं उनकी बातें भी की कि कैसे आप इन सबका ट्रस्ट जीत के चलती हैं. प्रॉब्लम सॉल्विंग की बातें आपने कही, ट्रस्टिंग रिलेशनशिप्स की बातें आपने कही, और आखिर में जो आचार विचार और व्यवहार में लीडरशिप की बात है वो मुझे सबसे बढ़िया लगी. इसी के साथ आई विल hand it over to Rohan. Thank you so much again for giving me the chance to lead this discussion.
Great. Thank you. Thank you, Dr. Myra. I will start by saying that we are very sorry कि बहुत सारे लोग हैं जिनके comments में नाम रिया गुखारुक से आ रहे हैं. ये कोई technical glitch है, उसके कारण हो रहा है. I request you please, अगर आप change कर सकते हैं और अगर आपके comments हैं, हम आपके नाम miss करेंगे अगर आपका नाम रिया गुखारू होगा. तो अगर आप तो अपनी comment के end में भी अपना नाम छोड़ते हैं तो उससे बहुत मदद होगी. Thank you. Thank you everyone. अब आ गई है बारी ऑडियंस के सवाल जवाब की. अगर आपके पास कोई सवाल हैं प्लीज उन्हें कमेंट सेक्शन में ऐड करें. मेरे पास एक सवाल है जो मैं डॉक्टर कावेरी मायरा से पूछना चाहूँगा. मे बी मैं पहले हिंदी में पूछूंगा और उसके बाद इंग्लिश में. डॉक्टर मायरा, जैसे हमने खासतौर पे सोनिया से सुना कि धीरे धीरे काम करते करते लीडरशिप आती है, और जैसे संजना जी ने कहा कि देन यू बिकम मोटिवेशनल और इंस्पायरिंग टू अदर कॉलीग्स ऑफ योर्स, राइट? आपकी भी शुरुआत आपकी करियर की नर्सिंग से हुई और उसके बाद आपने आगे पढ़ाई करी. अब आप बहुत सारे रिसर्च और पॉलिसी के स्फीयर्स को टच करते हैं, राइट? मेरा सवाल आपसे ये है कि क्या आपका एक्सपीरियंस एक नर्स होने के कारण जो आपका ओरिजिनल एक्सपीरियंस है उसको आप इन रिसर्च और पॉलिसी की जगहों पे कैसे ला पाते हो, राइट? और ये मैं इसलिए भी पूछ रहा हूँ क्योंकि हमारे कई सारे क्लाइंट्स, पार्टनर्स जो इंटरनेशनल लेवल पे जिनके साथ हम काम करते हैं, उनसे हम देख पाते हैं कि क्योंकि वो नर्स हैं, वो समहाउ इंट्यूटिवली समझते हैं कि नर्स की क्या रिक्वायरमेंट या ज़रूरतें होंगी, और एक नर्स का इतनी बड़ी लीडरशिप पोजीशन पे होना सडनली जो पावर डायनामिक है उसको एकदम बदल देता है. तो मैं आपसे जानना चाहूँगा कि आपके अपने अनुभव से, from your own experience, as someone who studied nursing and practice, when you now enter spaces of policy and research, what are the significant advantages or difference that you make when you are in rooms like this in health?
Thank you so much, Rohan. I think I would start by reiterating that I still remain a nurse. It's just that I am a nurse researcher. I'm a nurse who has made some contributions in policy making, in nursing and health systems research. और ये मुश्किल है क्योंकि हम ये नर्सिंग में देखते नहीं है, पर हम ये देखते हैं कि अगर आपको कोई बदलाव लाना है एक बड़े लेवल पे, तो ये बहुत इंपॉर्टेंट है कि आप पॉलिसीज में बदलाव लाएं। और ये विजन, जैसा कि हम आज स्पीकर से सुन रहे हैं ना कि आपका एक विजन होना जरूरी है, फिर आप पैशनेटली उसको चेज करते हैं। बात नर्सिंग लीडर बनने की नहीं थी किसी भी लेवल पे, बात ये थी कि एक एक मुद्दा मिला था और उसके बाद बहुत पैशन के साथ उसके लिए काम करना था। फिर बातें सीधी हो जाती हैं और थिंग्स फॉल इनटू प्लेस। बट ये भी है कि मैं आई ऑफन से दैट एज नर्सेस, इफ यू लुक एट अ मेडिकल हायरार्की, अगर आप देखें कि कैसे एक हायरार्की बनी हुई है, डॉक्टर्स हैं, हेल्थ पॉलिसी मेकर्स हैं, आईएएस ऑफिसर्स हैं, फंडिंग ऑर्गेनाइजेशंस हैं, इन सब में नर्सेज एकदम नीचे आते हैं। और एक वो बात हो जाती है ना, व्हेन यू आर एट द बॉटम द ओनली वे इज टू गो अप। तो ये नहीं रहता कि मतलब फेलियर का डर नहीं रहता कि बात आप करते जाओ, उसके बाद सुनने वाले सुनेंगे। और क्योंकि ये है कि वो चैलेंजेस जो हम देख रहे हैं वो हमें इतने अच्छे से पता है, वो हम इतने अच्छे से सह चुके हैं कि ऑब्वियसली जब कोई पूछ रहा है तो नर्सेस की बात नर्सेस सबसे ज्यादा अच्छे से रख पाएंगी। और ये किसी भी प्रोफेशन के लिए ट्रू है। इट्स जस्ट हम मेडिसिन में देखते हैं कि डॉक्टर्स को वो मौका मिला हुआ है, वो अपनी बात आगे रखते हैं, वो अपना रिसर्च खुद करते हैं। इसीलिए नर्सेस को भी आगे आने की जरूरत है और आसान नहीं है आगे आना। We do need very well-meaning supporters, and we do need to keep saying our word again and again, and we won't be heard. There'll be a lot of frustration, but अगर पैशन है किसी चीज को लेके तो फिर बढ़ने की जरूरत है, यही बात है। थैंक यू।
Great, great. Thank you so much, Kaveri. और I'm sure जितने सभी हमारे colleagues हैं जो TNAI से जुड़े हुए हैं already और वो आपकी बातें सुन रहे हैं, I'm sure they find it deeply, deeply inspiring and motivational. I will encourage on your behalf, in case if anyone is interested in doing this work or more of this work or studying and creating evidence, please Dr. Myra से contact करें. Yes. If there are any more questions or comments, if anyone would like to just come online, please raise your hand so we can call on you, or you can leave a comment, or you can leave a question. अभी हमारे 140 लोग 145 जुड़े हुए हैं. Anyone who has a question or comment, please raise your hand and we'll unmute you.
Hello.
Hello. Ji. Hi.
Can you hear me?
Please. Yes, we can. Can you please introduce yourself?
I'm Mrs. C.S. Tada. I'm the Vice President of TNAI Northeast Region. So, sorry I joined earlier, but Evelyn is our secretary. So I'm so happy that she spoke earlier. I just like to, as Madam just now, she was telling that when they look at the hierarchy in the health system, the nurses are always at the bottom level. So I have been working as, I retired as a Deputy Director Health Services in the government of Arunachal Pradesh. So I have almost more than 25 years plus experience in administration. What I find is when we talk about administration and reaching up to the top level, as your theme is today, the nurses in India have always been, so to say, sidelined. We are not able to make it to the policy level. We do get designation, deputy director, joint director, etc. but it is always a domination of the medical professionals. So my appeal here, even to Madam Kakar, who is in the government of India right now, my appeal, which I have been doing for the last 25 years plus until now, is that unless the government of India creates a Director General of Nursing, nursing has to be entirely a separate department in the Ministry of Health. Then only I feel we can, then only I feel the nursing profession will reach up to the mark. Otherwise, we are always a subordinate to the medical professionals. It is always, even you finish your PhD and super PhD and whatever, you may go up in the educational level. But unless we have our own department in the Ministry of Health, we cannot achieve anything, I feel. But I'm just praying and hoping. I have been to many many meetings in Delhi, in the government of India level, when I was in the service, and this has been my appeal for the past 20 years, that now the government of India has, of course, at one level, at one stage, they had given an order where all the states can have their own directorate. So, Directorate of Nursing. This is one of the most important thing that happened in India. But sad to say that I think now there is only one Directorate of Nursing. I think that is in West Bengal, in Calcutta, West Bengal. And now I heard that in our Northeast, Mizoram is going to start the Directorate of Nursing. So, my dear friends, nurses who are everywhere, I feel that every state should work towards that, a Directorate of Nursing, so that the nurse can take control of her own policy making, and the nurse can show her talent and her aptitude, and she will be able, to lead the profession in the correct way, and it will percolate right down up to the level of total health care for the patients. So right now, even when we are in the hospitals, if we ask for something, the nursing instruments or the nursing things, usually we don't get, because priority is always given somewhere else. So our priority is always in the background. So I feel that the government of India, yes, they have already given instruction that the state can have a Directorate of Nursing, but it will be better if we start from the top. So if there is a Director General of the medical professional, there should be a Director General of Nursing. Then when there is the identity of the nursing professional will be seen at that time, and then we will be able to make a policy decision, take a policy decision. That is my humble request. Thank you so much for giving me this opportunity. Thank you.
Thank you so much, Sister. Dr. Kaveri, would you like to respond? I saw your hand up.
I would love to respond to this. Thank you so much, Mrs. Tada, for saying that. I think हमारे देश की सभी nurses, not just people who are here, many of them आप देख सकती हैं कि बोल रहे हैं कि हाँ हम भी agree करते हैं मैडम के साथ, but it actually is one of the major demands right now, that not just for every state, that we need our own nursing directorate at the central level as well, because it just stops at the deputy and joint director level. And also these formal decision-making positions, even in the regulatory bodies, in our state nursing councils, and we often see that are held by either doctors or just basically non-nursing people. which is very, very damaging for nursing governance in general. So I absolutely support this, and I do know that Odisha actually has the director of nursing position. West Bengal, I don't think has the highest position, but yes, that is absolutely a key demand for nursing in every state. Thank you so much for putting that forward.
Thank you. Thank you.
Great. We have Miss Y. Shailaja. Your hand is up. If you'd like to, please unmute
Good
yourself and speak.
evening. Can you hear me? Yeah.
Yes, we can. Thank you.
Nice that I am very happy to see such platforms has been created for the leadership development. As Mrs. Kannan has already explored opportunities in nursing, and there are lots of things now we can see in nursing field.
I'm so
Yes.
sorry, Miss Shailaja, if you could please introduce yourself so maybe everyone will know a little bit about where you're coming from.
Okay.
Thank you.
Hi, I am Vaishalaja, a CSR healthcare professional with a passion to serve humanity and stand up for justice and equality. I'm having a 3 years, 3 decades of experience in health sector. I was as bedside nursing for 20 years, and from last 13 years, I'm in CSR, that is community social corporate responsibility. So I have shifted from this by seeing the pathetic conditions of the women, those who are coming with like induced labor, threatened abortions, and all. So this made me feel that yes, there is still lack of awareness about basic family plannings. So I have switched from my corporate hospital to corporate responsibility, uh, feeling that my passion is attached over here, and I could bring more resources and more skill and expertise in my area of work. So, as the previous speakers have mentioned, it is really very challenging for nurses being the kept in the low means at the lower level of the hierarchy in a management position. And the career path is also very difficult for nurses because we are a whole timer workforce, and we have to do our work. As we are in a workforce, we need to earn for our family also. We cannot think of just doing academics for the purpose of continuing our this thing. So when I was doing, then I got this opportunity to continue my education through IGNU. That is, it has provided us post basic BSc nursing. Then we could do hospital management, and recently I completed my master's in social work also through this IGNU, because it is the only flexible program which is providing nurses to continue their education as well as their work. We cannot sacrifice our blood earning possibility just for the sake of education. So this continuous learning, and I actually give credit to COVID also. So many online programs now we are having accessibility, and we can do it as our own comfort zone. So I feel this courses which are providing us now, recently I have completed my NLP course, that is neuro linguistic program, and I think this nursing professionals should know this neurolinguistic also. Like when we ask the patient about the pain, how much pain you are having, instead of that, we should ask how well you are feeling, so that there means we are not inducing the negative aspect in the from our communication. So communication skill is, I think, one of the most important thing which we nurses have to develop. And like we find many discrepancies, problems in our health system, and we have to raise our voice. So whichever field we are there, whether it is in a community, whether in the hospital, whether in a nursing home or private sector, we have to be observant and we have to raise the voice. And for the raising the voice,
Great.
we need to have the back support. And I feel that not only nurses, it may come to any medical fraternity or any medical professional who are raising their voice and being the whistleblower. So somebody should be there to protect their whereabouts. So I think this is where the most challenge the nursing profession is facing nowadays. And because they are not getting that type of opportunity, they are setting back at whatever position, whatever comfort zone they are there. Sorry, I took a little longer time, but I think that we take various platforms to speak up, whether it is TNI, whether it is Insan, like suggestions forums, and now I am attached with NAPCAM also for looking into the integrated medicine and the health sector. So these are the various platforms where we can develop our skills and attitude. If we have the zeal, I think we can become the voice for transforming the healthcare delivery system mainly, because that is most
Thank you
important.
so much.
So it is nice that policymakers are also being and included in nursing professionals are included in policy making level. So thank you very much for setting up this thing. And I have suggested earlier also that such type of leadership program should be organized from TNI. And I am a public health committee member of Jharkhand State Branch also. And previously I was a vice president. And now I really thank this platform for giving this opportunity and conveying this message. Actually, I think more and more people will be interested to join such type of programs. Thank you.
Right, right. We've already heard from Evelyn ma'am about everything that's been going on with respect to education and the value of really skilling through and along with the professional journey seems to be also really, really important. So thank you for also underscoring that again. If there's any other question, yeah, there's one question on the certificate, which seems like a smaller one. But if there's anyone who would like to raise their hand, then maybe one final question is what we can take right now. Okay. All right. Then maybe I can ask if any of our panelists would like to have the closing word. If there was anything that you heard in today's conversation that was surprising, that was nice to hear, maybe. सोनिया, हम ये कह रहे हैं कि अब क्योंकि ऑडियंस से और कोई सवाल नहीं है, maybe Riya, if you can this. अगर आपको भी आज जो बातें सुनी उससे कुछ अलग नया कुछ सीखने को मिला, कुछ ऐसे सरप्राइजिंग लगा आपको, उसके बारे में अगर आप कुछ शेयर करना चाहो तो वो हमारा आखिरी क्लोजिंग सेंटेंस होगा और उसके बाद हम सबको थैंक यू बोलेंगे।
सर ये मेरे लिए नया ही है, क्योंकि हम नर्सों की बातें कोई मतलब ऐसे हमें ऐसा लगता है कि सुनते नहीं है, तो हमें इतना मतलब महत्वपूर्ण मानते हैं। और मुझे मतलब इतना मौका मिला, उसके लिए आपको बहुत बहुत थैंक यू कि यहाँ मतलब बोलने का मौका मिला और मेरी बातों को सुना समझा, उसके लिए थैंक यू।
Great, thank you so much, Sonia. Maybe Sanjana, if there was anything that stood out for you in a half a minute.
सॉरी रोहन, मैं को एक लास्ट स्लाइड मेरी प्रेजेंट करने रह गया था, प्लीज एक बार वो आप कर दोगे? यस, तो मैं बस ये जो है इसकी एक स्टोरी बताना चाहती हूँ। तो एक हमारे क्लिनिक में जहाँ पर नेटवर्क कनेक्टिविटी नहीं थी, so one in early days we were just a woman with severe diabetes, she came to us and उसने कहा मुझे कहीं नहीं जाना, आप whatever you can manage you please do here. So and उस दिन वहाँ पर nurses की टीम ही थी. So the nurse every few maybe half an hour 1 hour she would go on the bike, एक पहाड़ के नीचे पहाड़ चढ़ के जाती, she would call the doctor and then plan treatment. वो किया उसने, इसी तरह she kept doing 3-4 times and in this time the woman stabilized and she got better. Why I am sharing this is कि अगर ये नहीं होती, अगर वहाँ nurse नहीं होती, there is no way we could have saved the woman. है ना? So many hundreds, thousands of lives we have been able to save because there were our nurses out there who ensured that the women, the patients got the care. तो एक तो मैं just ये बताना चाह रही थी रोहन, शायद थोड़ा ज्यादा समय ले लिया, but very nice being here and seeing so many people joining, कहाँ से join किए, और also very nice to meet Dr. Evelyn and Kaveri. और मेरे को ये भी लगता है कि आज से जो हमारा डिस्कशन एक स्टार्ट हुआ है मोर ऑन नर्स लीडरशिप, इसको हम आगे और कंटिन्यू कर सकें, मोर इंडिविजुअल कनेक्शंस, बट हम इसको छोड़े नहीं एंड वी कीप वर्किंग ऑन दिस.
One, yeah,
Thank
I
you.
just add one more thing.
Evelyn ji, please.
Yeah,
Yes, please.
I think that means every nurse, we need to have some passion towards our job, whatever we do. Because sometimes we think that, oh, nursing will not change. There is no change. No, we need a change. I need a change. So I cannot bring the light to the entire, sabko wo nahi kar sakte. But every nurse, whether even we are a student, if I check the vitals, if I do my bed making properly, all the procedure, I think as a nurse I can make a change. So वो passion होना चाहिए. और क्या होगा कैसे होगा नहीं पता. Let me make a change. Let me do the change. So मैं छोटा सा दिया हूँ, वो वहां का डार्कनेस मेरे को रिमूव कर सकते हैं. सो वो क्यों सैटरडे आ गया, कब मंडे हो गया, तो कब फ्राइडे आ गया, वो एटीट्यूड नहीं होना चाहिए. आई थिंक वी नीड टू वो कब मंडे आए हम एक काम कर जाएंगे, नहीं, वो वाला पैशन से हम लोग लेट अस फॉल इन लव इन नर्सिंग, व्हाटएवर वी डू, वेदर यू आर रिसर्चर, वेदर यू आर एडमिनिस्ट्रेटर, वेदर यू आर ओनली फर्स्ट ईयर स्टूडेंट, and whatever way we do, let us fall in love. The way we do everything we changed. So that was the one message I would like to let us fall in love in nursing, whichever the area we are do. Hope we will bring a lot of changes wherever we are.
Okay, thank you. Kaveri, I will pass on to you for a last 30-second quote and then I will close.
Absolutely. I think I have been heard quoting this before as well. मैं चाहती हूँ कि जैसे घर में बच्चे बोलते हैं ना, बड़े होके क्या बनना है, डॉक्टर बनना है, इंजीनियर बनना है, तो मैं चाहती हूँ कि हमारी आज की जो जनरेशन है, कई सारी नर्सेस की, we make nursing and take it to a level where children are growing up aspiring to be nurses. And I think for that, there are many areas where you need to find passion and help, that be a dream that's possible. So thank you so much.
Great. Thank you so much. Thank you, Dr. Sanjana, Evelyn, Sonia, Kaveri. आप सबके समय के लिए thank you to all the participants who were able to join us from different parts of the country. Thank you to the TNAI for spreading the word about this. To me, what stands out is the value of care. खास तौर पे कोविड ने हमें सिखाया कि केयर करना कितना ना सिर्फ जरूरी है, बट ये कैसे हमारे जीवन के सभी फेजेस से और हर समय से जुड़ा हुआ है. और नर्सिंग एक तरीके का काम है जो actually takes up or thinks about care as work, which is why I think if we are able to think about nursing as care and how care is essential for all of us to live, not just care for ourselves but for others, that's really going to change and sustain all of us. So thank you so much for all the care that you all do. Thank you for reminding us to care. Thank you for taking the time to do this and taking all this work. And we hope to continue this as we go forward. We will be putting together notes as well as publishing this recording on the internet. आप सबके इनबॉक्सेस जो भी जिन्होंने भी रजिस्टर किया था, हम आपको ईमेल भेजेंगे इस डॉक्यूमेंटेशन के साथ. और ये रिकॉर्डिंग और नोट्स ये हमारे जेंडर कोलैब के वेबसाइट पे भी अवेलेबल होंगे 2 हफ्तों के बाद. Thank you so much everyone for all your time and effort. Have a good evening.
Thank you everyone.
Thank you.
Bye-bye.
Bye.
Thank you, Dr. Kaveri, for moderating the session. Good.
Thank you, ma'am.
Mr. Rohan.
Thank you all.
Dr.
Thank you.
Thank you, Dr. Renu.
Thank you, madam.
Thank you,
madam.
Thank you.
Thank you, Evelyn, madam. Thank you.
Thank you so much.
Thank you, madam. Thank you all.
Thank you, madam.
Thank you.
You cannot see me.
Yes, ma'am, we can see. We can
Can you see me?
everybody.
I don't know. Bye-bye.
Bye, ma'am. We can hear your voice, ma'am. Thank you, ma'am. Thank you for very much. Very good input. Thank you.
Yeah, thank you.
Thank you, ma'am.
Thank you very
Thank you so much.
Thank you, Fulana, madam from Odisha. So almost all the states are there, Mr. Rohan. All the states are representing.
Yes, ma'am.
Very nice
program.
Thank you for Sikkim, Odisha,
Thank you,
West
ma'am.
Bengal, Delhi, almost all the states are here.
West Bengal
Jharkhand,
also.
Jharkhand, Goa, yeah. Thank you, Madam Rubina. Goa, every state we could see. Yeah.
Thank you so much,
Thank you.
ma'am. Such a
Yes, ma'am.
wonderful,
Thank you.
informative session. Thank you very much.
attending, ma'am.
Thank you, Gujarat. Thank you, sir. Gujarat, sir. So many
Maharashtra.
participants. Maharashtra. Yes, thank you, madam. Yes.
Thank you, ma'am.
Thank you. Thank you so much for participating.
West Bengal.
From West Bengal, yes.
Yes.
Ma'am, Delhi.
Delhi already bold diya. Everyone, all the states, A to Andaman, Nicobar, say Jammu, Kashmir, madam also was there. Somebody was from Kashmir. Yeah. Pondicherry, Puducherry. Thank you. Yes.
Thank you, ma'am.
Thank you, Chhattisgarh. Chhattisgarh में है. Madam Dr. Sindhu Anil, Chhattisgarh. Thank you. All the states.
Thank you, ma'am. Good night.
Okay. Thank you all. Good night. We will be closing the room in a minute. Thank
Yes,
you.
thank you. Stay safe. Good night. Take
Good
care.
night, madam.
Thank you. Good night.
Oh, Meghalaya.
Yes, Meghalaya.
Great.
Meghalaya, Uttar Pradesh, Uttarakhand, all 5 regions are here. Thank you. 34
All right.
branches.
Great.
From
We will,
34 branches. 34 branches from 5 regions. Thank you for representing. Yes.
Great. Thank you so much, everyone.
Thank you.
We
Thank
will
you,
close
ma'am.
the room
Thank you.
now. Have a good
Yeah.
evening.
Thank you.
Bye-bye.
Bye.